We're here with day 2 of the conference, and I have a special guest with me, Mr. Christopher Bates. He's going to explain how you're doing, first of all. Thank you so much for sitting down with Urban Socialite. We appreciate it. Just give us a little insight as to your background.
Again, Christopher Bates is my name. I'm the Deputy Director of the Office of HIV and Infectious Disease Policy with the U.S. Department of Health and Human Services. I also serve as the Executive Director of the President's Advisory Council on HIV and AIDS. I'm here at this conference because it's important. It's one of the one or two venues where Black gay men have an opportunity to come together and educate each other and one another about this epidemic, to support one another in training sessions, to also do networking among us, and to start building capacity within our own community for us to take care of our own lives. And me as a Black gay man, it's important, particularly because I'm an older Black gay man that's been around for a while doing this work, for me to support the work that young people are committed to here at this conference, and my colleagues across both the Department of Health and Human Services, but also other state health departments and local health department representatives that are participating in this conference.
Okay. Now, you said with the young people, are you finding that you're getting some really good positive feedback from the young people, or are we still trying to pull them in?
I am amazed at not only the number of young people that are attending this conference this year, but also the diversity among the young people that are attending this conference. There are a lot of degreed young people with master's degrees and PhDs that have very significant jobs across this nation in health departments working in this arena. We also have some young people who are already involved in behavioral and biomedical research, and they're here talking about the work that they're doing. That's terribly exciting to me.
For me too.
But additionally, we have grassroots kids here too. People who are still, finding their way academically. Some are, going to college or making plans for college, but are interested in this arena, and they're already starting to do work. And they are our frontline people, and I think we all have to support them.
Yes, we do. Now, this is not your first conference, is it?
Oh God, no.
No? What can you tell any difference between the previous ones and what's different about this particular one? Because we've interviewed a couple of people and they all seem to feel like this one was probably the best of all the ones they went to.
Okay.
What are your thoughts?
I have said to my friends who I know have been to this conference several times before that I like the energy here. I feel that the networking level has elevated. I think that the cross-section of people who are networking is very, very effective, and I'm listening to the conversations. I find the conversations very rich. I find the conversations also very complex, which tells me that people are doing their homework, that people are familiar with the issues and familiar with some of the responses. And I think people have a lot of good ideas that they are proposing to us. And definitely I've been in conversations with people, and I will be taking those messages back to Washington.
And what do you want to, for us, me included, to leave here with?
I think the important thing to leave here with is lots of phone numbers, lots of email addresses, and with a commitment not only to do the work in your local community, but to keep this network that people seem to be feeding into here alive, and not let these connections that you all have formed here I can't talk right now, dissipate, because it's so important that this network that you create now grow, and that as that grows, your capacity to reach into communities and to affect people's lives, not just around HIV,
Right.
but in a lot of different venues, is very, very important. And I think you all are the ones to do it, and I'm glad that I'm here to witness.
Okay. Now, when will you be in Atlanta again?
Well, I don't know. The next time CDC invites me down for a meeting, or the next time I'm invited to some other group's meeting in Atlanta, I always look forward to it.
Thank you so much for sitting down with Urban Social Night. We really appreciate it. I know I have learned a lot from this weekend, and this is only day 2. We still got 2 more days to go, so I really appreciate it.
It's my pleasure.
And anytime you're in Atlanta, please, by all means, look us up.
Thank you very much.
All right.
I look forward.
All right. And
Take
we're
care.